Hi, welcome to your checkup. We are the patient education podcast, where we bring conversations from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Dulesky, a family medicine doctor in the Philadelphia area.
And I'm Nicole Rufo. I'm a nurse.
And we are so excited you were able to join us here again today.
Why are you looking at me like that?
I don't know. You've had the giggles all day. You really have. The like Emu Limu commercial came on, and the bass on the sound bar was like way too high, and it was like Emu Limu, and you just go damn. It was like a bassy man's voice. Damn. I was like, oh my God, you startled me. I was startled by the commercial, and then I was startled by you. Damn.
I think I startled myself.
And you were startled by a sound. You've had the giggles all day. And then, we woke up in this type of mood. I mean, if this was a visual podcast, you see that we're like wrapped in two blankets. I have like Mother Mary going on with a white blanket over my head right now. You have like Bali sunglasses on right now.
Yeah, I got cute new sunglasses for Bali.
And you're wrapped like a babushka in this like teal fluffy blanket. Gravy is on the, excuse me, gravy is on the stovetop. Got up early to do that. We're trying to get Jones to poop.
Oh, yeah, he's been sick. We took him to the doctor, though. Well, Eddie did, because some of us had to go to work. Oh, wow, it's really bright in here without these sunglasses on.
The blinds are completely closed, and they, darken the room entirely.
No, but... Maybe the sunglasses are just that good. They're cute, right?
No, they're cute. I like them. Yeah, I like them. They're cute.
Bring them to Bali with us.
Yeah, we're doing some research on Bali by watching Real Housewives of Orange County during those episodes to try to understand what Bali looks like. It's not helping me at all.
No, all they're doing is fighting in the hotel.
Yeah, so that's not helpful one bit.
But yeah, Ollie's been sick. He had a little stomach bug. Eddie took him to the doctor. He got little puppy fluids. He's so cute.
He's improving, though.
He is. He's better. He's pooping regularly, semi-regularly. So, road to recovery.
Road to recovery. I made burgers last night. You seemed to really like them.
Yeah, that was a good burger you've been making. I feel like you've been sleeping on burger making and have been holding out on me.
On burger making. Let me tell the good people. So, we used regular beef, like ground beef, but you could do ground turkey. I didn't actually use the onion that it calls for. A third of a cup of breadcrumbs, a tablespoon of Worcestershire, a tablespoon of Dijon mustard, a teaspoon of paprika, which we didn't have, half a teaspoon of garlic powder, teaspoon of kosher salt, unless you have hypertension. I'm kidding. Half a teaspoon of fresh ground pepper, and an egg. You mix that up and put it on the cast iron, and you really liked it.
Yeah, it was really delicious.
Yeah, so that was good. And then it is fantasy football season. I am obsessed with
fantasy football season,
my drafts and things like that. So I'm working on that on overtime.
You're such a good fake football coach.
Thank you. Yeah, I listen to podcasts about this, do relentless research. The boys in the locker room, we're assembling our team, multiple teams, and it's going to be fun. We're going to see where it goes. And I think we're going to put together a good squad this year, make a good stretch run. That's what football coaches say, I think. Get the boys riled up in the locker room, you know?
Yeah.
Yeah, it's going to be good. I bought these shorts with underwear built in. Is that underwear?
Well, I mean, I don't know if that's I think it's just supposed to be like a compression short, but that's basically your underwear. Not to be weird.
Yeah, well, it really brings it to a single use then. Not that if you're wearing underwear, maybe you can reuse a short if you're wearing it lightly, right?
Yeah, I think so.
Yeah, so that was fun. And then a handheld water bottle because I'm seeing people run around and they're holding water. And I will go not far distances, but reasonably far distances and not have water. And I'm thirsty when I'm doing that stuff.
How did your run feel today with your water?
Thank you. It felt good today. It felt nice to be able to just run with it. It kind of just slides right on your hand, so you don't have to change anything. And it was good. I probably ran about the same length, exerted myself about the same amount, but it felt nice to have the water with me, so I didn't have to be parched.
Hydration.
Yeah, hydration is key, a major key, if you will.
And we got a new monitor. We had ourselves a little day yesterday.
We did. Well, I'm starting work soon, and I wanted to be able to multitask and have two things up at once, or just have a better display. And I am very pleased, because previously I just used
Do you have it up right now?
Oh yeah, I have the show notes right up on the
really
the screen right now. Yeah.
Wait, let me come look.
Yeah.
Oh, this looks great.
Yeah, we got to get you one of these. Yeah, it's good. It's a good monitor, and the guy helped us out. They're making laptops these days that look pretty nice.
Yeah, I think we should get some.
Like,
I want one too.
Have a lot of laptops. What are you going to do with a laptop?
I don't know. What do people do with laptops?
What you're going to do on your phone?
Surf the web. I'll book our next vacation.
No, that'll be nice.
We got to rack up the credit card points. Got to buy 2 laptops. We use all our points for our honeymoon.
I don't know.
Got to rack them back up.
As economical as
That's
it makes it
how
sound.
that works.
And then any other thoughts before we dive in here?
I don't think so.
Okay. Well, what are we going to talk about today, Nick?
Today we're talking about the liver, some metabolic liver disease, and the new FDA approval for Wegovy and all of that.
Yeah, and today's information is grounded in consensus guidelines from the American Diabetes Association, systematic reviews, and major clinical trials, putting all of this stuff together for you in what seems like 3 segments today. So before we dive into all of that, I really wanted to introduce the idea about what the liver does. I went out on Threads the day we're recording this, and I was like, do you know what the liver does? And a sassy biology teacher of 30 years was like, yes, look it up. I taught biology for 30 years, which wasn't the intent of the post. It was to invite...
a little literal.
It was a little literal. It was to invite that it does a lot. The liver is very important. It is a large organ located in the upper right part of the abdomen, just below the ribs right there. And it has a ton of important jobs. Nick, why don't we go back and forth kind of reviewing what these important jobs are? I will kick us off.
Okay.
One major feature it has is filtering and cleaning the blood. And by that, I mean thinking of toxins. Certain medicines and drugs and other waste products from the blood get processed through the liver. It also helps break down alcohol and, like I mentioned, other medicines before moving it to other parts of the body where it's easier to handle. What else does the liver do?
The liver helps with making important proteins. It produces an important one like albumin, which keeps fluid in the bloodstream, and helps with clotting factors, and helps to stop your bleeding stops your bleeding after an injury.
Yeah, all extremely important stuff. Very easy for those things to go awry. All one simple organ doing all those complex things. What it also does is it helps store energy, actually. The liver stores sugar, which can be broken up into smaller particles of usable energy, and releases them to the body when the body needs energy. It also stores other vitamins and minerals, like it has a lot of stores of iron in there as well. What else is it good for?
It helps us with digesting food. The liver makes bile, which is a yellow-green fluid that helps digest the fats in our food. And it's stored in the gallbladder and then released into the intestine when we need it.
Yep. And the liver also helps regulate cholesterol and other hormones. So it's involved in managing the level. It's also involved in creating certain types of cholesterol. Cholesterol is much more complicated. We have episode 43, which discusses the other types of cholesterol to think about, but the liver also has an important job as it relates to cholesterol. And I'll just jump in here and finish out that it also helps support the immune system. So the liver itself can help remove bacteria and other germs from the blood in some smaller role that it has. So the way that various clinicians can help and check and see if the liver is okay is they have certain liver chemistries that they can look at to detect liver injury or disease. And these are ones that you may see on your own labs, looking like ALT, AST, alkaline phosphatase, bilirubin, and albumin. And so abnormalities in these may tip off that there's something to think about, but honestly, that's like such a niche thing with you and your doctor to think about. But those are the labs that people most of the time look at. Nikki, can you take us through what when things go awry, when these liver enzymes may be abnormal or they may not be? What are some common causes of liver problems?
Some common causes of liver problems include fatty liver disease, alcohol use, viral infections such as hepatitis, some medicines, and sometimes you can inherit different kind of liver conditions.
Totally. And there's a lot of things that can, obviously, as you mentioned, common and uncommon, that can tickle the liver or really send it to go haywire. The liver is resilient, but sometimes people fly too close to the sun and the liver gets, beat up a little bit too much. Many liver diseases don't cause symptoms at first. And so that's why getting your checkups and getting some blood tests can be important for people who are at higher risk. To highlight on your list right there, fatty liver disease, or otherwise in medical language, metabolic dysfunction-associated steatotic liver disease. This is the thing that you may see as MASLD, is the thing that we talk about in the second segment today, becoming one of the most common causes of liver injury in our society today. So on like the end of the extreme, if the liver isn't working well, people can notice symptoms like yellowing of the eyes or skin, swelling in the belly or the legs, easy bruising and bleeding, and overall feeling an intense set of fatigue. And so if you notice these, don't pass go. Make sure you connect with your doctor. So now that we have a broad overview of what the healthy liver does and general concepts, what we really wanted to dive into is MASLD, or the thing called metabolic dysfunction-associated steatotic liver disease. It used to be called non-alcoholic fatty liver disease, but this new name has more of a patient-first type of denotation when you're talking about it. So it's not so much like the person is the disease, it's that the person has this. And that's why the name is so long. It was a recent change in the last couple years. So I'll kick us off here. The question remains is, what is this? Well, MASLD or MASLD is a common liver condition that occurs when too much fat builds up in the liver. This falls squarely in the bucket of visceral fat, that fat that we're talking about that builds up in the abdomen. And it ends up usually being linked to things like being overweight or having obesity, type 2 diabetes, high blood pressure, and high cholesterol. Nikki, can you key us in about why MASLD is so important?
Yes. It's actually the fastest growing cause of cirrhosis and liver cancer, which is not good. It's also linked to higher risks of heart disease and kidney problems.
Yeah, it's extremely common and has been frustrating to treat until recently when there are new medications available, both GLP related and non-GLP related. So the question comes in of like, how do you know if you have it? How do you know if you should get checked out? It is diagnosed by blood tests, noticing those abnormal liver enzymes perhaps. Someone may get an imaging study, like an ultrasound or an MRI or some other imaging study, and it may incidentally come up and be noticed. And in more rare cases these days, the gold standard is a liver biopsy, which sounds dramatic. It's not the easiest thing in the world, and it's a little annoying, but less commonly used, but really that's a really common thing to use to diagnose this. And in truth, when putting all of that together to capture this diagnosis, it requires liver fat, metabolic risk factors like we talked about before, and ruling out other causes of liver injury, some of the most common ones being alcohol or hepatitis. You know what? Since you always get this, I'll take this one because you always end up talking about how things are treated. And what I will say here is that lifestyle changes end up being the first thing to do. I kind of want to kick us off with a 5 to 10% total body weight loss can help. There is a lot of evidence that suggests that weight loss helps slow down, stop, or even reduce and reverse the liver injury because of this. And so really sincerely take it into account that like if you're thinking about your weight and your doctors mention, hey, you have some fat in your liver, that's a solution. I'm not proposing that it's easy, but that's something that could be done. And then you think about managing the other health problems, like control blood sugar, control your cholesterol better, and make sure that your blood pressure is under excellent control. So an interesting piece is that specifically, there are no medications available for MASLD, or the fatty liver. And that's specific because while that's an umbrella term, underneath that umbrella, there is a later stage, something called Metabolic Dysfunction-Associated Steatohepatitis, which means that there's inflammation and damage, and that there also can be scarring in the liver, and potentially downstream cirrhosis, which is excess scarring in the liver, and liver cancer potentially. Soon in our next segment, we're going to talk about that delineation is important because there is a recent FDA approval for a GLP-1 medication, Wegovy, to be approved to treat MASH, or that long name that I said earlier. I am glad that we're spending so much time talking about this because this is so incredibly common. There is a recent New England Journal of Medicine review that came out August of 2025, which suggests that up to 38% of the population worldwide is affected by MASLD. And that proportion of people is even higher in certain subgroups, like people who have type 2 diabetes. And that suggests that the prevalence of that, which is the number of people that have that in a population at any given time, could be about 65%. So this review suggests that now this is the most common chronic liver disease globally and is continuing to happen here more and more frequently. Okay. So can you, since we took a little step away from what MASH is there, can you tell us and remind us what MASH is?
MASH is a severe form of the MASLD, but with inflammation and actual damage to your liver. And this can lead to fibrosis, cirrhosis, or cancer.
So enter GLP-1 receptor agonists. And this is a brief summary review. These medicines were originally developed for type 2 diabetes and the management of the chronic disease of obesity. And they help people support blood sugar control and weight loss. And recently, in a trial, they were shown to improve liver health as well in MASH. All of this in totality being related to metabolic health and the management of metabolic dysfunction. And so the FDA approval comes on the back of semaglutide, a GLP-1 agonist for patients with MASH in a moderate or advanced fibrosis category. What that means for anyone out there is that certain tests done or imaging studies done to point you in the direction that it's a moderate to severe scarring in the liver. And of note, it's the first medication specifically approved for this condition. There is another medication approved for helping liver fibrosis, is resmetirom. We won't be talking about that today, but that is another medication. The idea behind how they work is essentially to improve liver health and resolve inflammation. There is an evidence that it reduces the actual scarring in some patients, which is amazing. In addition, it helps support weight loss and improve blood sugar, cholesterol, and heart risk factors, all in all being very helpful and approved here. Basically, what we're seeing is that like they're going down the line, finding any obesity-related complication and trying to get FDA approval for these. Last year, we saw them approve Zepbound for sleep apnea, and that's been very helpful. And now we're seeing Wegovy or semaglutide be approved for treatment of MASH. So all in all, it's a really cool development that there is an extra tool in the toolbox to be more proactive and help people with this condition. This is something that's incredibly common, like we talked about earlier, and it should be taken so seriously. It's something to be proactive with and get checked out for. So hopefully this was helpful for anyone listening. Well, thank you for coming back to another episode of Your Checkup. Hopefully you were able to learn something for yourself, a loved one, or
a neighbor.
Check out our website. Come visit us on Threads. I'm literally on there all the time. You can email us at yourcheckuppod@gmail.com. But most importantly, stay healthy, my friends. Until next time, I'm Ed Dulesky.
I'm Nicole Rufo.
Thank you and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.